The Strategic Corporate Select Committee, this is Wednesday the 17th of September 2025. I'm Councillor Dan Roper, Chair of the Strategic and Corporate Select Committee. I'd like to welcome you all to today's meeting and quickly go over some general housekeeping. This meeting is being held in person at County Hall and is also being streamed live on the County Council's YouTube channel. The recording will also be available to view afterwards. A fire alarm is not expected during the meeting. If the alarm sounds, we must evacuate County Hall. I would suggest following the Chief Fire Officer. In the event of emergency, please make your way to the nearest exit and meet at the muster points located in the main car park. Note on microphones, when using your microphone, please make sure it is switched on and speak towards it. This will tell the camera to focus, be heard on the live stream. And of course, when you're finished speaking, please push the button to turn off your microphone, as this will allow the system to pick up the next speaker. So we're turning to item 1 on the agenda. Any apologies for absence, please?
Thank you, Chair. We've got an apology today from Councillor Keith Kiddie. Councillor Margaret Dewsbury was due to be here to introduce the fire service report. Unfortunately, she has also sent her apologies.
Okay, thank you for that. If we move to item 2, the minutes of the meeting held on the 16th of July. Are we content with those minutes, committee? I see agreement around the room, so thank you. Number 3 is updates from the Chair. Can I remind committee members of the briefings taking place in the Margaret English room directly after this meeting? And can I also remind members of the additional special meetings on Monday the 22nd of September on LGR and Friday the 10th of October on devolution, which I'm sure we've all got in our diaries and are looking forward to. Number 4 is declarations of interest. Any declarations of interest in the room, please? I see none, in which case number 5 is public question time, and there are no public questions received. And item number 6 is local member questions, and there are no local member questions received. In which case then we come to the main item on the agenda, the Norfolk Fire and Rescue Service Community Risk Management Plan for 26-20. We have a report from the Chief Fire Officer. In the absence of the Cabinet member, I'm afraid I'm going to look towards the Chief Fire Officer to see if there is any introduction that you would like to do for us, please.
Yes, thank you. The Community Risk Management Plan is a really important and core part of what we do as a fire and rescue service. It's one of the only areas of local government where the public and stakeholders are asked to contribute to the strategic direction of how things are running and how resources are allocated. In previous, cover a 3-year public consultation time, but we felt that given the changes with devolution and local government reorganisation, a 5-year timescale would be more appropriate, not only to make sure that we had been clearly set we could start to implement the changes across that strategic planning period and as the new governance arrangements bed in. The Fire and Rescue National Framework for England mandates that we create a risk management plan, and it was changed to be a community risk management plan over the last 5 or 6 years to make it more community centric, and really I hope that you'll see as we've written this that it is community focused all the way through. It outlines our strategic approach to how we've assessed risk and how we will respond to fires and other emergencies over the next 5 years. It ensures that the service remains fit for purpose and that we are addressing both the current and evolving risks, which include things like climate change, new technologies, and the major demographic changes that are happening within Norfolk. To address that, we've split it into 4 key themes. So one is identifying risks, so that's the current and existing risks within Norfolk. Adapting to change, so anticipating the future challenges that are facing us and how to plan for them and train for them. Supporting our people, so making sure that we have a workforce that is safe and well and can uphold the professional standards we expect and that our communities expect from us to have confidence in our service. And importantly, working in partnership, recognising that by bringing our resources together across the public sector and across the different systems, we can have a bigger impact for our communities. We've undertaken extensive consultation in pulling this plan together, and then once we have had input from this committee and been to Cabinet, that will go out for a final stage of consultation before coming back for final decision. We've ensured that we've engaged with seldom heard communities and made sure that we're at community events to understand what's really important to the people of Norfolk, the businesses of Norfolk, holders that we work with. Over the last 12 months, we've considered significant our residents, our businesses and the environment. So this is really important to get this right and understand what are the priorities for people within this room and the wider community so that we can move forward effectively. So I would ask you to review what's in the document today. We have tried to make this CRMP more accessible in terms of how easy it is to understand the risk, how easy it is to understand what we're working on. But if there is anything that's ambiguous and requires clarification, we'd be more than happy to work through that. Thank you.
Rescuing people with disabilities is probably harder than able-bodied. Rescuing people with disabilities is probably harder than able-bodied people. There's a section on ethnic diversity, and I can't people. There's a section on ethnic diversity, and I can't, you know, I don't understand what the relevance of ethnic diversity is in the context of why that was there. Obviously, population growth I can understand. You know, as the population grows, we need to gear up for the extra potential for work. So just the query, I think probably the disability is there for that reason, and just whether the ethnic diversity, whether that needs to be there, because just, you know, I don't think that ethnic diversity should come into dealing with fire and rescue. Fire and rescue.
Yeah, so if I can respond to that, there's a number of reasons that we've included ethnic diversity within here. Predominantly, it's related to our ability. To gain the trust of all of our communities. So if we don't engender trust in those communities, then our prevention messaging can be much less effective. Sometimes we also need to consider language barriers. And whether we've been able to reach people in terms of their own language. So if I take the Ukrainian population that came over to Norfolk, for example, we did lots of home fire safety visits on the properties that they would be going into and making their homes here, but making sure they understood how the fire and rescue service works in the UK, how they could ask for help, and those types of areas. It's really important. We also know that some communities are disproportionately impacted by accidents and emergencies, again because they might not know how the structures and the prevention activity in our county and what's available. Thank you.
Thank you, Chairman. That clarification is very helpful. Obviously, the reason behind it and the explanation is not there with the fact that the detail is included. So the fact that that's been sort of drawn out is helpful. What I would say is about the...
Reach out to those in their own languages, and also wondering about risks around people who have perhaps come into the country very recently and might be vulnerable because of that, and how that's accounted for within this plan, please.
So obviously we have limited resources, so what we don't do is translate everything that we have into multiple languages, but we do work closely with partner organisations, and we also try and engage directly with the populations that we're trying to reach. So we will sometimes attend events that are happening for those communities. We've attended events with the Kenyan community. We work with the County Council's diversity team as well, who've done some in-depth work with adversely impacted populations such as the Congolese community within Norwich. So we tend to work with partner agencies, with individuals who are kind of representatives and advocates for some of those communities. And quite often what we learned through COVID in various parts of the council is we don't need to translate everything for everybody. We need to work with representatives who will then do that for us and help broker some of that confidence building in the communities there. But also being out and about at events within local communities, local towns, and having that visible presence does really help with this type of activity as well. Thank you.
Thank you for that. We've got Councillor Kemp.
Thank you. And first of all, I'd like to piggyback on that question as well. And I'm aware that with ethnic minorities, there is a risk, as explained to me by a previous Chief Fire Officer, that where you've got flats in Kings Lynn with lots of ethnic minority people that perhaps don't read instructions for gadgets, there's an extra fire risk there. So that's something which I am aware of when we were talking about the crewing arrangements for Kings Lynn South Fire Station. But my question is about the prevention work that you do, because your vision is to keep Norfolk safe. And there's nothing more important than that. And you're working with vulnerable people, of which we've got 134,000 in the county, particularly people living on their own with disabilities. And one thing I wasn't aware of that's in the report, you've got a new system called a personal demisting units, so that somebody on their own, that where the house catches fire, it raises the alarm and also provides a protective mist. Could you expand a bit more on that, how that works, and how you're reaching out to people, how many people you've offered this to, and what the funding is, please? And I've got another question, if I might, after that, Chair.
Yeah, so this is quite a new initiative that we've brought in, and it was based off some learnings from some fatal fire reviews, because where people are immobile, that's where the greatest issues occur. And quite often, even if there's a working smoke alarm, if those individuals are not able to kind of remove themselves from the area of danger, that can be quite problematic. It's quite a complex funding structure of how we've looked at this. It's probably not appropriate to go into all of the detail today, but I just wondered if I could bring in Assistant Chief Fire Officer Tony White to give a bit more information on this area.
Hello. Yeah, that's sorry. Yeah, so the portable mister units is a fantastic initiative that our prevention team have worked with partners. You may have already seen some of the national work our prevention team have done regarding emollients and emollient safety. Only recently we've released a video which is going UK-wide around the dangers of not just alcohol-based emollients, but those that are alcohol-free. The Mistine units is kind of separate but kind of linked to that kind of initiative, where we are aware there are bedridden individuals who are receiving some kind of care plan, but that doesn't include really mitigating the risk around those individuals that continue to smoke because of their habits and sometimes continue to drink as well whilst bedridden. So as an additional protection measure, we offer the Mistine units, which is, as it says really, a portable, it's a self-contained bottle of water with a Mistine unit attached. So it detects heat and flame and will suppress that automatically. It is really just that additional piece of reassurance for family members and for carers when they can't be there 24/7 to protect the individual, because it's very difficult to break ingrained habits. Now, of course, there's pendants, telecare, and of course ourselves that will be there as well, but it's just an additional measure. And I agree with the Chief Fire Officer, to talk about the funding model is probably a bit complex at this time, but just rest assured we are doing the best we can to make Norfolk safer. Thank you.
Thank you very much for that full response. And if I just might ask Chair as well, on the investment that you need, you've indicated you need a new hire training facility, and also you're trialling a new flexible crewing system. And I was just wondering how that would work, and because you're not planning to reduce any staff or any fire stations, are you?
So there is no specific funding ask directly with this paper. What we have tried to do is flag the things that are in our forward capital plan and our continuous improvement programme anyway, but we haven't costed any specific initiatives or activities within here because there isn't a definitive ask around those. Everything that is mentioned here is already in train, with the slight exception of our estates programme, and we've flagged that there's some work happening with national government to try and secure funding around that. Our flexible crewing model that we're looking at is around how we operate our on-call models. So we are trying to make it much easier for people to work across stations. So again, without getting into too much detail, in order for an on-call appliance to be available and able to go out, you have to have the right number and the right mix of people to go onto that appliance. So you have to have a driver, an incident commander, and at least 2 people that can wear breathing apparatus. Now, as you can imagine, people whose primary employment is elsewhere are not available 100% of the time. So what we've been doing is looking at different ways to say, actually, if we've got a surplus of people in one area and a fire station that's maybe 5-6 miles away that has a deficit, can we move those individuals to put another appliance into availability? So we've been looking at some quite complex calculations around how we do that, because what we don't want to do is move a person and then take a different appliance off the run. So it's quite complicated, and we do constant monitoring of fire cover and dynamic resource availability. So it's all done very much in the moment, but it shouldn't cost more. It should provide better availability using the resources we've already got.
Thank you.
Following up once again, just on the misting units, roughly how many have we got out there at the moment, and how many are we looking to get to by the end of this plan?
So the misting units, so again, I do need to go and check the information on this, but my belief is that we have purchased the misting units and the cost model works in terms of renting them back out to either care providers or housing providers. I do not have the exact figures. What we were doing was doing a proof of concept with a smaller number, checking that the business case worked and that the payback period was appropriate, and then scaling it up. So I can get that information and bring it back to the organisation. But again, we are not asking for a funding increase to support that, because it should be cost neutral to the fire and rescue service, as well as providing that additional protection to residents. Thanks.
Yeah, thank you, Chairman. A couple of points, just a general thing.
As possible, so that those sites are developed in a way that where it's safe to operate, safe for residents and safe for our firefighters who may need to respond to them. We've got really good relationships with all of the planning authorities across Norfolk, so where we put recommendations forward, they are usually taken on board and written into the planning applications, but we don't have any enforcement powers to insist on those on an ongoing basis. So that is something that we are lobbying for and that we'd like to see brought in over time. In order to keep on top of those, we have to put resource from our protection function to monitor the planning portals and check when those planning applications are coming up. So that's a resource intensive activity, which if we were statutory consultees, we wouldn't need to do. So we will always provide input and advice to make any type of development as safe as possible. But yeah, as I said, the battery energy storage is the one where we've raised the profile recently, because we feel we should be statutory consultees on that. In terms of the water rescue and flooding incidents, so because of the prevalence of water-related activity and incidents in Norfolk, this does put pressure on our budgets. Not so much from a response perspective, that is something that we would factor in, but particularly in terms of training, in terms of PPE for our responders, and making sure that we've got additional equipment that wouldn't necessarily be provided, so boats being a key example. So they all need to come out of the overall budget, and it does make it tight and make it quite difficult, both from a training perspective and equipment perspective. I think we have something like £60,000 allocated for water response, which, as you can imagine, with over 600 firefighters does not go very far in terms of even basic training before you even get to the PPE and the additional equipment like boats. Thank you.
And the financial situation, are you in a situation where you've got, well, I'm sure you've got control of it, but having to make savings on a year-to-year basis?
I think the fire and rescue service finds itself in the same position as the rest of the public sector, where we're having to make choices and make decisions that are difficult. I think we've had a lot of investment over the last few years, so where we've been able to provide evidence and information to the county council, then we've had the investment we've needed to respond to that. So if I take the example of the wildfire incidents in 2022, we did a comprehensive report as to what was needed, and we got £1 million investment to buy additional 4x4 capability, additional wildfire PPE, misting branches and specialist equipment, and that I think has played out this summer when we have got the kit equipment, and we've done the prevention activity that helps our communities understand that, for example, when they call us, if they use what 3 words, we can get there a lot quicker and easier, rather than just saying it's down X lane in somewhere in a very rural location. So I think a combination of things. overall, the financial picture is difficult, as it is with all the public sector, but I feel that there's sufficient investment in our frontline services at this point in time. I think the capital programme going forward is something that we need to consider carefully. I've already mentioned the estates element. Thank you.
Thank you. Just on that point again, just around the long-term funding for USAR, because I know it's been a thing which has been grant funded before, and there's been doubts about the whether that's going to continue. Just attention to what the current funding position is on USAR and how secure that is over the 5-year period of this plan, please.
Yeah, so USAR is our urban search and rescue capability within Norfolk. It's part of a national resilience set of assets. So there are kind of sphere, which would include things like our high volume pump and other key bits of kit and equipment. Our USAR team came under threat in early 2023, where we were made aware that there was likely to be a cut to Norfolk's USAR capability. We did some significant lobbying. We were supported by all of Norfolk's MPs, and again put a strong evidence base together to say that actually the risk in Norfolk had not changed, and that for other USAR teams to reach us, if we were to have a significant event, it would be too long a period to support optimum outcomes for individuals involved. So we were able to keep that team. My understanding at present is there are no further attempts to cut Norfolk's USAR team, but what I would say is the funding that we get for that service is $800,000 a year. That has not increased at all over the lifespan that we've had the team. So there have been no inflationary increases, no uplifts to salaries, etc. But obviously we've had to put those in place as the national pay agreements have come in each year. So again, the pressure on that area is tight, and we have again been raising that nationally. And I think those of you who kind of keep abreast of fire and rescue sector news will see that the chair of the National Fire Chiefs Council has been raising a number of issues like this with national government. But again, we're very aware of the pressures.
I think he's a bit of a hoarder. He's living in a rat-infested flat, and he probably hasn't got any of the stuff he needs to have there. So how can we do that? Can I just add one thing? I did on a slightly different matter. I was quite surprised to see how many people are killed by deer accidents in their cars. And somebody told me a couple of weeks ago he's got lots of dealings with venison, and he said that if 60,000 deer were culled in Norfolk, there'd still be too many. And that's a real problem, isn't it? Too many. And that's a real problem, isn't it?
Thank you. So in terms of vulnerable older people, we do have strong relationships, as I mentioned, with partner organisations, so with the district, city and borough councils, and they will do referrals where they come across people who are vulnerable. I would absolutely encourage everybody here, as well as members of the public, to make referrals on behalf of other people with their consent. So there is a link on our website where you can request a home fire safety visit. And the other thing that we do, just to give some reassurance, rather than standing in the hospitals, we targeted kind of out in the community, checking in areas where we know that there are higher densities of older people or people that might have more vulnerabilities. So we have a mnemonic, which is Sherman, which identifies people that are most at risk. They're in every GP's surgery. So if you are concerned about a friend, a neighbour, a relative, you can make a referral into us, and we will then triage that and make sure that somebody gets out to see them. But we also do that proactive going out and looking for people in areas where we think they are more at risk. And you're absolutely right that things like hoarding can increase people's risk significantly. And then there are offers that can be put in place if people are willing to accept them. In terms of the deer, this was something that came about as part of our research, probably not for us to advocate how the deer population is managed, but to understand the risk and how that can be mitigated over time. Thank you.
Thank you.
Clearly, the position have another go at it and a rant, so to remind people, because I don't think it can be said too many times.
An evidence-based rant is probably how I'd want to approach it. So I think what we've done within the CRMP particularly is highlight the increase in water-related incidents that we've attended. So similarly to attending more fires in the open because of the warmer weather, the wetter weather is also causing incidents. And the range of incidents that we're attending is significant as well. So whilst our main risk used to be coastal inundation, which would happen very infrequently, what we're seeing now is a much higher proportion of incidents that are kind of inland flash flooding, and that not only does that cause issues within kind of domestic dwellings and properties, but we're also seeing impacts on fords. So the fords across the county, whilst they may look safe to pass, and people may try and assess how much water is in them, with fast flowing water it only takes a very small amount to reduce the amount of traction your tyre has got on that road, and therefore you can be swept off that road very, very quickly. And however many signs we put up and that highways colleagues put up, people do tend to just drive into them anyway, and that is causing significant issues. And sadly we've had a number of rescues and fatality and a fatality related to that. So the data in there does start to highlight that this is more and more of an issue. Similarly, we are seeing more people in crisis who either end up in water voluntarily or involuntarily, and that requires a different type of rescue response as well. So our firefighters, we had one incident where they ended up in the water for, I think it was nearly 2 hours, trying to support a person in crisis who was in the water, and eventually we did rescue that individual, but that's a long time for a firefighter to be in cold water trying to support somebody, and they will do it because they will always go above and beyond to support members of the public when they need help, but it does need to be addressed at a national level. And as I've said before, it is a statutory duty in Wales and has been since 2016, so it's something that we'd very much like to support in.
Can I assume there is broad committee consensus that we would like an evidence-based rant whilst the time is ripe? Okay, thank you. I'll take that as a yes. Back to you, Councillor Moore.
Thank you. I just think we need to be clear and make sure that we keep it on the record and keep it on the radar that the resources aren't coming from nationally, and we're not getting the powers and the statutory responsibilities that would actually drive the resources arriving. So I think we just need to make sure that even though we've said it any number of times here and we know what's necessary, somehow or another it's not being heard out there, and the more coverage we can get for it, the better.
Yeah, I have written to all of our local MPs setting out a number of areas of pressure that I'd like them to consider and be able to advocate on our behalf of, and I think it is important we keep that conversation going.
Thank you. Councillor Long.
Thanks for the indulgence, Chairman. One of the things that came to my mind when Councillor Bambridge was talking about her elderly neighbour, within adults, they're using artificial intelligence to sort of highlight those that are most vulnerable for falls, etc. And the parameters that they put into that could also establish those very folk, because they're accessing health records. Obviously it's AI, it's not like somebody's physically looking over other people's health records. AI is looking over health records and establishing a need. And I wondered if there was any work within the, whether any of that could come across to the fire and rescue in terms of, because seeing the work that's been done on preventative measures and how that's increased massively and has led to a massive decrease in killed as a result of fires. Preventative AI could well be a tool to target the very folk that need that intervention the most.
So yeah, we've actually been part of the adult social care trial, so on falls prevention. So as a result of using I think it's the Zantura software, correct me if I'm wrong on that, we were part of what are the early stage interventions that can be put in. So our prevention team are absolutely linked into that. And yes, of course, we'd love to see that extended across other areas where appropriate, but we do work really closely with both adults and children's.
That's absolutely excellent to hear that there's, people talk about, departments working in silos. Not anymore. That's exactly what we want to hear, utilising the the technology that's there to target the very people who need the help. So well done. Thank you.
Thank you. I think we all echo that. And I think a point which I'd make on this, as far as AI is concerned, 5 years is like a lifetime in how that will potentially develop in terms of the technology. And this plan is for 5 years. So it's needing to take that into account. Councillor Kemp.
Thank you, Chair. Yes, and your work also is about reducing accidents on the roads, and you do a lot of work with young people, 17 to 24, and older people. How is this how's this evidencing the reduction of accidents, and what more scope is there for you to do even more?
So obviously road traffic collisions are a major concern for us in Norfolk. We have got a huge road network here. I think we're the second largest road network in the country. We have played an active part, as you said, looking at prevention activity. Road safety is a really complex area, and a whole safe systems approach is needed. So we work with colleagues from Highways who will obviously building in design features when they're thinking about putting roads in the first place, working with police colleagues. One thing that we are particularly advocating within this CRMP is we're taking a more strategic approach. So I've joined the Strategic Road Safety Partnership Board, and our prevention team have led the first fatal accident review. So in the same way that we do for fatal fires, we've got all of the partners around the table and reviewed a particular incident to look at what could have been done differently, either to prevent the accident happening in the first place or to reduce the severity of the outcomes for the individuals involved. And some of that might be how quickly partner agencies have alerted each other. It might be about the care. There's a whole range of factors that could come out of that. So the first one of those was held, I think it was August. Yeah, in August, and that was really productive. All the partners found it really useful, and I'm hoping that we will then get to a point where we can further target prevention activity across those range of people who impact on our road system.
Chair, thank you. And if I might follow up on that, the partnership working that you do for safety involves work with the East of England Ambulance Service in these days of extreme pressure on the NHS. How is this assisting? How is this making people get to hospital earlier? What sort of work do you actually do?
So there are a number of areas where we work with ambulance colleagues. Obviously, we work with them directly at the scene of accidents and incidents. We support them if people have collapsed behind closed doors. They need to access those individuals, and we can help them get them out quickly, or help to remove complex patients from buildings sometimes if it's difficult to get them removed and access to hospital. The major area where we have been trialling some very innovative work is our emergency medical response to out-of-hospital cardiac arrest. So this is a trial we've been running for a number of years. So in our rural locations, using our on-call firefighters to respond to cardiac arrests where we know there will be a significant delay in the ambulance service being able to attend. So where we've operated this trial, we've increased the 30-day survivability rate from 2% to between 12 and 15% for Norfolk residents. So the national survivability rate at 30 days is 10%, so we've taken it from 2 to above the national level. We now have 12 on-call stations participating and 1 whole-time station participating in that trial. And the reason I'm calling it a trial is because it's not part of an official firefighter's role, but we've been doing this work so that, again, we can highlight the conversation nationally and talk about how we can make best use of public resources, particularly in rural locations, to make sure that we are making best use of public resources and having the best outcomes for residents. I would just flag that we do work with first responders as well, who obviously play an important part in that picture.
Huge achievement for Norfolk. Thank you.
Thank you. Any other members got any questions at this stage? Councillor Kilmore.
Yes, thank you, Chairman. Thank you for this CRMP. I read it with great interest. I think it's a well put together document compared with the ones that have preceded it. My colleagues, my fellow members, have put some very pertinent questions, much more eloquently than I. So I'm left with the sort of little bits at the end. You've based your proposals, your CRP, around the proposals of 8 proposals in the document. A couple of questions, or a couple of, I think, nitpicking questions, really. In proposal 3, you're effectively applying our legislation. Should our be in there? Should another word be in there? It kind of doesn't read right to me. So that's one. I've got some more. It's on page 40 of your document.
If it's not noted now, people can watch back and pick those points up.
I think the wording there is taking ownership of our accountability for the legislation, but I'd take your point and we can have a look at how that's worded. But I think it was to show that we feel a great deal of responsibility around this. So it's the legislative power, but I'll look at the wording. Thank you.
That's one. I have got another one. Proposal 4, which I can't get to because it's a bit of a scroll, but you're saying you're deploying, in that proposal, you're deploying assets to meet obviously the fire risk and the immediate risk to fire, or to fight fires, etc. But it also involves training, but surely those 2 assets are slightly different and should be separated?
Yeah, they are different, and this enhancing our response is a multifaceted area. And what we've tried to do with this CRMP is write higher level proposals, because we wrote very tactical ones in the past. So we would write things like remove gas tight suits. So we've tried to keep this more strategic, but there are a number of moving parts that we'll need to address over the next 5-year period, as we see the growth in housing, as we see different technologies, the battery energy storage sites, the offshore wind. All of these things will impact on where we have our stations, where we have our resources, what training we need to do, and that will flex over time. So it was about being clear that we would dynamically assess what the most appropriate forward plan would be, because if we make any changes to any of our resources, it doesn't happen quickly, because there are capital investments needed, everybody needs to be trained. So if, for example, in relation to water rescue, we said that we want to train all of our crews to a higher level of access, the PPE rollout would be a 2 to 3 year process, because you'd have to procure it, roll it out, all of those types of things. So we could change that into 2 proposals. We just didn't want to put too many in there when actually there's a lot of complexity behind that.
I'm not sure it needs 2 proposals. Probably just needs another sentence in that particular proposal to make the training slightly separate, because training assets are obviously different, being a trainer myself. The other one is proposal 7, which I've managed to flag up, and it said are protected from contaminants, and the contaminants, but there are contaminants in a fire station, obviously, because the stuff on board the appliances and in some of the cupboards are, but they'd be covered by COSH assessments, etc., etc. But what you're trying to say there is that the firefighters are protected from contaminants in the fire stations, and I'm not sure that reads right to me.
So we did a report on all of our fire stations to look at a number of different factors, which included things like welfare facilities, showering facilities, but also zoning for contaminants. So when you first come in to a fire station, if you've been out to an incident, you may have contaminants that are on your hair, clothes, etc., despite having taken off the main PPE that you've been wearing. So we like people to shower within an hour is kind of the golden phrase that we use. Some of our stations, or majority of our stations, do not have the correct zoning in place to allow people to move from contaminated areas through to clean areas, and some of them don't have enough showering facilities, particularly for people of different genders, so we don't have enough facilities for women. So this is a national problem, because as more is understood about carcinogenic contamination, more proposals and support mechanisms are being advised, and we're not fully able to implement those at the moment. What we can do, as you're right, is putting processes and procedures in place, but until you can design a system in where people can move from a kind of a red area to a green area, if you like, then we'll have some problems. The stations were designed a very long time ago, and we have different information and requirements these days.
I'm just wondering whether that should be in the preamble, what you've just said, because it isn't, as far as I can see, to make sure that is actually the proposal 7 actually makes sense because of what you said. It wasn't clear to me that that's what you have to do. I mean, I've been subject to decontamination for 22 years in another job, and I understand what you're going through. But it's not. I don't think it's clear in there as to what you're doing.
One of the things we could potentially do is link it to the previous cabinet report, so that some of that's laid out in a bit more detail. Because obviously this document's quite weighty already. We didn't want to put too much in there, but we can definitely strengthen that and then make a link to the previous report. Thank you.
It was yours, was it? Okay. Well done for opening up. Okay, thank you. Thank you. Just a question from me on a different area. Can I just ask about fleet management, because it explicitly states around the 51 fire engines that we've got. Obviously, we've got other vehicles in our fleet as well, the 4x4s and so on. Could you give me an idea about the greater range of the fleet? And also, I'm wondering about, over that 5-year period, is it considered that any of that fleet will need replacing? Is it considered that perhaps we don't quite need 51 fire engines, maybe we need 50?
People on, so so there's no reduction in the fire engines themselves. As I mentioned with the 4x4s, we purchased an additional 4 following the wildfires of 2022. We would like another couple of those, really, because they have proved very agile and helpful in dealing with smaller fires outdoors. Tony has got a forward capital plan. What we haven't put in here is the detail of the forward capital plan, because it's already set. So our fleet replacement is something that we kind of currently look at and work on, rather than something that we put as a proposal in here. We can add more detail if that's helpful. Our officer cars are rental cars. They're on a rental scheme. The majority of them, we have 6 that are resilience cars that aren't. So we have majority hybrid cars, and again, they come to end of life or end of scheme, and then they get procured. So it's kind of a rolling programme. We are due to go out to procurement for, I think it's 27 new appliances, because again the lead time is quite considerable and you only get them delivered a couple, 2 to 3 each year as they go through. So there are rolling programs for the majority of our fleet and our aerial ladder platforms. And again, many of you will have seen the new aerial ladder platform that we've just received into county, which is based at Earlham. So we're always looking at what is the newer technology, what needs to be replaced. But we do have quite a long shelf life for our appliances compared to some other fire and rescue services. So the majority of our fire appliances we keep for 15 years is the shelf life. So as you can imagine, there are quite a lot of improvements that can be made over those times. And again, from an environmental perspective, it's important we keep track of what the art of the possible is with those. So we've got the rolling programme set forward. We could include some of it in here if that's helpful.
Yes, it's very helpful. Thank you. Thank you very much for that. Any other questions at all from councillors? If not, I will then take us through to the recommendations that we've got in front of us. So we've been asked to, number 1, scrutinise and review the draft Community Risk Management Plan 2026 to 31, providing feedback on the content and the 8 proposals within Appendix A. I think the questions which were posed today is certainly part of our feedback on that, and you've already heard that we fully support a well-evidenced rant about the inclusion of water rescue capacity being included within the statutory functions and funding in the future. And number 2 is to recommend the CRMP to Cabinet for consideration ahead of the subsequent public consultation, and agree to review the document further in February following consultation. Are we all agreed with those proposals? Agreed. Thank you very much, everybody, and thank you very much indeed, Kerry and Tony for attending today. Okay, we move on then to item 8, the Forward Work Programme, and over to you, please.
Thank you, Chair. So, as in the report, this is just to highlight the Forward Work Programme for our coming meetings based on the work programming session that was held following last committee. It's over to committee to say their preference on whether they'd like to amend anything, whether they'd like to add anything. Yes, as I said, the work programme is included in the appendix there. So, thank you.
Thank you. Over to you, members. Are we content, or is there anything which we think needs to be moved or juggled or added? I'm taking silence as contentment. Are we all agreed?
Just a comment. I think with what we've got coming up, it's probably wise to keep our powder a little dry, because I think who knows what's coming over the horizon in the next few months.
We live in interesting times, don't we, Councillor Morphew? Okay, with that caveat in mind, have we agreed on the Forward Work Programme? In which case, I will declare the meeting closed. Thank you very much indeed, everybody, for your attendance and participation. Members, if you'd like to take 10 minutes before we start the briefing sessions. Back in there, yeah.